June 3 every year is observed as the World Clubfoot Day, a day to increase awareness on congenital talipes equinovirus, which is a condition where a baby's foot is twisted inwards and downwards at birth. The Regional Hospital Bamenda, together with the Cameroon Clubfoot Care Program of the CBC Health Services, on Tuesday, June 3, 2025, under the supervision of the Northwest Regional Delegate of Public Health, commemorated this year's edition.
Following the pertinence of the early identification and referral of Clubfoot, the Ministry of Public Health instructed the inclusion of a module to sensitize nurses, midwives, and medical doctors to identify Clubfoot early and refer them to the appropriate treatment centers that are going to ensure it is adequately managed. For the public health facilities, of course, the management is going to be done in specialized units at the level of these health facilities. These are the physiotherapy units, and these physiotherapy units have physiotherapists that have been put in place, and our regional hospitals are endowed with orthopedic surgeons that are well capacitated for the management of Clubfoot. So the resources have been put in place in public health facilities to ensure that every child that is identified with the Clubfoot can be effectively managed in the treatment centers that are available.
Commemorated under the theme Integrating Clubfoot Detection into Health District Activities for Early Treatment.
This disease that is not having a lot of information in the public, we want to use this opportunity to actually raise awareness on this pathology that is really neglected and people don't know what to do.
Early detection of the defection can be treated, which gives hope to the children born with Clubfoot.
Come. This is miracle. Wow.
Some parents whose children were born with Clubfoot can now smile after the treatment.
And to thank this organization for bringing this up, because it has added so many joy in so many marriages. Because the question that my husband asked me that day is, it was so disturbing. Who had this problem in your family?
They started with casting for 5 times, which was 5 weeks. They stopped it for that 5 weeks and the legs were straight. So they went now to braces, which was called the maintenance phase. They started putting on these shoes. They call it in hospital, they call it braces. Only during the casting periods, the legs were already turned. So that's where I started gaining my happiness from there. Until now, the legs have been maintained. And I can say the legs are fully strong now. The child is sitting down firmly.
According to global statistics, 174,000 of new cases are recorded every year. 200 cases in low and middle income countries, with only 31,800 cases enrolled for treatment as of 2017.